Welcome, Home Health Aides. In this module, we're focusing on the essential qualities that make a truly great HHA. Today, we'll dive into Chapter 4 of our module, Professionalism and Ethics. These aren't just buzzwords. They're the foundation of trust, respect, and high-quality care. Understanding and practicing professionalism and ethics will empower you to provide the best possible support to your clients while protecting yourself and your agency. Let's get started. So, what exactly does it mean to be professional as a home health aide? Let's start with your appearance. Dressing neatly and appropriately is more than just looking good. It's about showing respect for your client and your role. Your clothing should be clean, comfortable, and practical for the tasks you'll be performing. Think about non-slip shoes for safety, and avoid anything too revealing or overly casual. For example, imagine you're visiting a new client for the first time. If you arrive in clean scrubs, your hair neatly tied back, and minimal jewelry, you immediately convey an image of competence and care. On the other hand, arriving in wrinkled clothes or heavy perfume might send the wrong message. Your appearance helps build that crucial first impression of reliability and trustworthiness. Next, let's talk about focus. When you're with a client, your full attention should be on them and their needs. This means avoiding personal conversations or distractions, especially from your phone. Your client's home is your workspace, and it requires your undivided attention. Engaging in long personal calls, texting friends, or scrolling through social media during your shift is unprofessional and disrespectful. For instance, you might be tempted to quickly check a text message, but what if your client needs immediate assistance, or wants to tell you something important? They deserve your full presence. Think of it this way. If you were the client, would you feel comfortable knowing your HHA was more interested in their phone than in your well-being? Keep your phone silenced and out of sight unless it's for work-related communication or an emergency. A cornerstone of ethical care is keeping all client information confidential. This is absolutely critical. You will learn sensitive details about your client's health, their personal lives, and their home environments. This information is private, and it's your ethical and legal responsibility to protect it. Discussing a client's health issues, financial situation, or family matters with anyone outside of your care team is a serious breach of trust and can have severe consequences. Imagine you're at the grocery store and you run into a friend. They ask how your day is going, and you mention a funny story about a client's pet, or perhaps a detail about their medication schedule. Even if you don't use their name, sharing any specific information that could identify your client or reveal their private life is a breach of confidentiality. Always remember, what you see and hear in a client's home stays within that home, and with your authorized care team. Your honesty is paramount, especially when it comes to documentation. You must report honestly and never lie on documentation. This includes charting care provided, medications administered, and any observations you make. Accurate and truthful records are vital for ensuring your client receives the correct care, for communication with the rest of the healthcare team, and for legal and billing purposes. Falsifying records is not only unethical, but also illegal. For instance, let's say you were running behind and didn't have time to complete a specific task like a range of motion exercise that was on the care plan. It might be tempting to just check it off as completed to avoid getting in trouble. However, doing so would be dishonest and could compromise your client's health or lead to an incorrect assessment by other healthcare professionals. Always report exactly what happened, even if it means admitting something wasn't completed. Your integrity is invaluable. Maintaining professional boundaries is essential. This means not becoming personally involved with your clients. This includes not accepting gifts or favors, not lending or borrowing money, and absolutely no romantic or overly personal relationships. Your relationship with your client is professional, focused on their care needs. Crossing these boundaries can create uncomfortable situations, blur the lines of your role, and even compromise your ability to provide objective care. Consider this common scenario. A client, out of kindness, offers you a significant gift or asks you for a personal favor, like picking up their dry cleaning on your day off. While their intentions might be good, accepting these goes against professional boundaries. Politely decline, explaining that agency policy prevents you from accepting gifts or performing personal errands outside of your direct care duties. It protects both you and the client. Another crucial aspect of professionalism and ethics is respecting client autonomy. This means recognizing and honoring your client's right to make their own choices about their care and their life. Even if you don't entirely agree with them, your role is to support and assist, not to dictate or impose your will. Provide information, offer options, and empower them to make informed decisions. For example, your care plan might suggest a particular activity for your client's mobility, but your client expresses a strong preference for a different, equally safe activity. Instead of insisting on the original plan, you should listen to their preference, and if it's safe and appropriate, adjust your approach or discuss it with your supervisor. Empowering them in their decisions fosters trust and dignity. Your attitude and conduct significantly impact your client's well-being. Always maintain a positive and respectful demeanor, regardless of the circumstances. Even on challenging days, professionalism means leaving personal frustrations at the door. Treat every client with dignity and kindness, speaking to them respectfully and listening actively to their concerns. Avoid complaining about your job, your personal life, or other clients while on duty. Imagine you're having a particularly tough morning before arriving at a client's home. It's easy to let that negativity spill over. However, a professional HHA understands that their client depends on them for a sense of calm and reassurance. Entering with a cheerful greeting and a focus on their needs can make a huge difference in their day and yours. Your positive attitude is part of the care you provide. Another key part of professionalism and ethics is understanding and respecting the limits of your role. This is called staying within your scope of practice. As a home health aide, you're trained to assist with many daily tasks, like bathing, grooming, helping with mobility, taking vital signs, and observing for changes in condition. But there are specific medical tasks you are not licensed to perform unless you've received advanced certification or specific delegation from a nurse. Being ethical means knowing these boundaries and sticking to them, even when you want to help more. Let's say a client asks you to inject their insulin or adjust their oxygen flow. You may feel tempted to say yes. Maybe they're in pain, or you don't want to disappoint them. But unless you've been explicitly trained and approved by your supervisor to perform that task, you must politely decline. Instead say, "I'm not allowed to give injections, but I'll notify the nurse right away so they can help you." This protects you legally, keeps your client safe, and ensures proper care is given by the right person. Professionalism and ethics are not just rules to follow. They are a mindset, a commitment to providing excellent, compassionate care. Now for our class discussion prompt. What would you do if a client asks you to stay and have dinner with them after your shift ends? This is a tricky one. On the surface, it may feel like a kind gesture. But staying after hours can blur professional boundaries. The best approach is to thank them warmly, explain that it's against your professional guidelines, and leave on time. Always prioritize ethical behavior over emotional comfort. Being a home health aide is about more than just doing tasks. It's about doing the right thing, even when no one is watching. Your professionalism and ethics define your reputation, your relationships, and your impact. Thank you for your commitment to excellence. We'll see you in the next chapter.